I wanted to talk a bit about what we've been doing recently, and specifically related to how we are working through maternal health and the challenges that are associated. Like Kali mentions, it's been a bit of trying to understand what we can do different to change the way service is given and to change the way people also look at the service. So the challenge that we had when we started in March this year was how can we increase early entry and continuous access to care. And this is specifically for pregnant women. And what is interesting about it is that we decided to go at it through radio. If you think about it, few people, if any, actually conduct research via radio, just because it's a public platform. There's very minimal control. There's hardly any chance that you'll get approval from a research approval body like an IRB committee, and specifically so in Kenya, it's particularly hard. So when we got this idea, it was absolutely scary, but that's what we do. We get scared and then we dive right into it. So we partnered with main radio station, a national radio station in Kenya. The name is Citizen Radio. If you look at my left, you can see at the top there is something called Citizen Radio, which has a listenership of about 14%. The last one has about 0.1%, so you can probably estimate how influential Radio Citizen is. So that's exactly why we went with Radio Citizen, just because it's got a really good listenership across Kenya. It's got really good listenership in rural areas and in peri-urban areas. So this was also another strong point. And how we approached it was through this partnership with presenters, specifically a lady and a gentleman, just bringing it back again. We are talking about maternal health. We are going to be having conversations with women and trying to see why is it that they actually don't go to hospital when they are pregnant. If you look at Kenya, you might realize that our maternal mortality ratio is about 342,000 per 100,000 live births, and compare it to what we are working towards from a sustainable development goals perspective. We need to bring it down to about 70 per 100,000 live births. So that's pretty high, and I think it's across majority of the developing countries. So this is what really inspired us. We want to make it easier for young women who are teenagers, who are first-time mothers, who are experienced mothers, to just walk confidently into a health facility, be able to say that I want to get checked up when I'm pregnant. I do not know if I am pregnant. Will I get a test kit or will I not get a test kit? I do not want to meet a midwife who will harass me, who will talk to me so rudely, which is a predominant issue across most facilities in Kenya. So that's what we wanted to do with these two presenters, just bring up those conversations and see what it is that we can try to do different. You might ask yourself why she does not look like a mother, intentionally so, just because she's a young woman. She's about 25 or 26. She resonates very well in women in informal settlements, who are one of the people we wanted to engage with, and just understand how does the situation look like in Mathare slums, for example. In Kenya, we've got Kibra slums, which is one of the largest slums across sub-Saharan Africa. But for this time, we went to Eastleigh, which has an informal type of settlement setting. The lady, her name is Melody. She's fashionable. She's got a huge Instagram, huge Facebook following. She's got almost 1 million type of in terms of statistics. So she's really influential, and if she speaks about maternal health, she resonates with that experienced mother, she resonates with the first-time mother, she resonates with the teen mother. So that's why we wanted to work with her. Vincent is the other presenter that we worked with, and he has a commanding voice. Vincent walks into the room and you want to listen to what he says. So we were looking at how to just really engage with the audiences in this, using these two presenters. We selected a primetime breakfast slot, and in Kenya we call it Jambo Kenya. If you think about what do you know about Kenya? It's got one of our biggest culture is actually just the matatu culture. Everybody in the morning is in a matatu. listening to a certain breakfast show. Everybody in their houses is listening to a Jambo Kenya or sorts. Everybody in their office or in their personal cars is tuned into a Capital FM. So those are the types of radio stations that we have in Kenya. And it really just goes to show you why radio was the good spot to just generate conversations. And as compared to going into focus group discussions, into one-on-one interviews, we saw this as a different way to just generate this type of discussions and across Kenya. How did we execute it? We worked very closely with the presenters to just understand what type of touch points would people interact with very easily. We tried to bring in a tagline such as every pregnancy is one pregnancy, and specifically so because we noticed that across majority of experienced mothers, you'll find that they do not want to go to hospital for care because they think that I have been there before. I know what it means when we're talking about morning sickness. I know what it means when you're talking about a huge belly, abdominal pains and such like. So they tend to disregard repeat visits and they only go when they're first-time mothers. The moment they're a second-time mother, that story is not happening anymore. So another way that we tried to do it was to share positive experiences of prenatal care, of pregnancy phase, just because talk to any woman today and the first thing you will hear is my labor was absolutely crazy. My delivery day was ridiculous. The nurse was not there. My husband was not there. There's a lot of negativity. So we went in and immediately began to prompt people to share positive experiences because this would also be a way for us to understand what works and what do we need to change. You might be curious about radio, very good. National platform, very good. But really, how was the result? So we saw majority of those who called in being men, surprisingly so. Antenatal care is about women and it's about taking care of yourself when you're pregnant, but men have a lot to say. So 59% of the call-ins were from men, 41% were from women, but we must not forget that women are busy people. In the morning, we are cooking breakfast, we are taking our children to school. I mean, we've got a lot of things to do, so that's kind of understandable. If you look at the SMS perspective, majority of those were female. And what does this all mean for us? So we saw that, and these are some of the interesting findings. We just predominantly had that both men and women expressing that the service in health facilities is just really negative. If you walk into a hospital, you want the type of experiences you ideally want is somebody who will welcome you. Remember, you're in labor, you're in pain, so you want somebody to take care of you, to address you properly, to show you where to go, to show you where the lab is, to show you to a delivery room, but hardly ever this is the case. So that came out as one of the takeaways. One caller even expressed that a few women who are not pregnant think about single mothers, they just will not go because one of the things they will hear is that I'm not going to help you just because you are not supposed to be here without a husband. In places like Malawi, that's one of the main barriers to uptake of cares. There are regulations that you have to go to hospital with a man and preferably your husband. We also saw some callers give us insights such as some parents will not take their children to hospital. Remember, there are some who are teen mothers. Some will not take them to hospital just because they're afraid of the perceptions. It's some type of stigma for you to have a daughter who's pregnant and is unmarried. So that's one of the reasons why they'll keep her at home until it's about month number 9 when they're supposed to give birth. And that's the first time they go to hospital. So as we all know, this is particularly dangerous, and especially if you have conditions such as HIV, such as blood pressure, you need to get care early, and this is one of the reasons why we were pushing for early entry. Another type of takeaway was really just the service design, the structural design. If you walk into a hospital, there's a lot of confusion. You don't know whether you're supposed to go to the lab, you're supposed to go to the reception. There are typically very long waiting times at reception, and a lot of women, even those who are coming to ANC, kept expressing that I go to the hospital at 8 a.m., I leave at 1 p.m. So that's about 6 hours. Think about this is a mother who needs to take care of her household chores, of her children and her husband and things like that. So we had a lot about the experience, and specifically coming from midwives. We had a lot about the type of services that they get and how much time it takes. We had a lot about the stigma. So here you'll see some of the just the verbal fast expressions that we saw. Somebody expressed that some clinics are like army barracks. Think about an army barrack. It's strict. There's no room for empathy. So that's what they likened a health facility to. Think about this person who expresses that she comes to a facility at 8 a.m. and sometimes you will be sent away. Sometimes it will take time, like about 6 hours, like I mentioned before. That's not a positive experience, and especially for a pregnant woman. Think about this person who expressed that he took his wife to a clinic during her first pregnancy and they laughed at him and he got ashamed. And that's one of the reasons why he doesn't go back. Think about this lady who's wondering why they use fingers to check on pregnant women. So that's a digital vaginal examination and it's very uncomfortable. So again, it's a barrier to access. So there's a lot of feelings that we had, and we felt that radio truly is a platform that can provide you with valuable insights. What did we learn? What type of lessons can you take away as a designer and you're exploring maybe using radio as opposed to focus group discussions or in partnership with focus group discussions? The first thing was that women are passive listeners, and especially in the morning. So if you go to radio and you expect that women will call in and actively engage, you might not get that. You might need to possibly wait for SMS scripts, or you might need to go to a mid-morning talk show. We also kind of sense that women have strong opinions, and these are some of the things we really saw when we read the SMS scripts. But then interestingly enough, men are the ones who are going to voice those opinions. So we saw a lot of men just saying that we are actually speaking in we are actually representing our wives' opinions at this point because maybe they couldn't come, they are at work, they are busy. And then we saw that usually when we do research, one of the things we are taking care of is the social desirability bias. And here we did manage to eliminate it. The interesting bit is that it introduced a new bias, which is basically priming. So we could sense that if a caller number one comes in and shares a positive experience, the next caller will most likely share a positive experience. If it happens that the previous caller shared a negative, the rest of the callers tended to share also negative experience. So we saw a lot of that. And how we just went around it was to work really closely with the presenters to help them understand that there might be issues in terms of the types of insights we get if we don't manage the type of conversation. So we worked with them really closely to just throw in questions, probing questions, to ask for the right people, to ask for the right type of experiences that you wanted to hear, and that worked. We ran teasers for about 2 weeks before each session because we had a series of 2 episodes, and before each we ran 3-day teaser, and this just helped to generate interest, excitement, and we saw a lot of call-ins, even referring to the teaser period. We also thought about the framing bit and designing the conversation flow and how it helps us to achieve invaluable insights together with the presenters.